A hearing in Lansing gives a hot mic and the public record to a wild array of vaccine conspiracy talk. But if you can set that aside, is it ethical for American businesses to enact COVID vaccine mandates? Is it ethical not to? And while Afghanistan roils from the sudden pullout of American troops, another Mideast country has many in Metro Detroit deeply worried: Lebanon in free fall. Today is Sunday, August 22nd, 2021, and this is Flashpoint. Hi, welcome to Flashpoint. Great to have you with us this morning. We remain on a crisis footing on a number of fronts as we join you today. In fact, it's hard to remember when that wasn't the case, and that is thanks in large part to the novel coronavirus. And can we focus for just a moment on that word novel? In this usage, the dictionary tells us that novel means of a new and unusual kind, different from anything seen or known before. Yes, we're all frustrated that the advice and guidance for dealing with COVID-19 shifts and wiggles so often, but that's because it is of a new and unusual kind. And this clever and nasty virus has the capacity to morph and evolve, which means it keeps getting novel. So we have to stay on the balls of our feet. The one thing we do know so far is that the vaccine is the best way to combat this deadly pandemic that has taken 620,000 American lives. And yet, when Brad Williams of the Detroit Regional Chamber pointed out that very fact in a hearing in Lansing on Thursday, he was actually booed. We heard hisses, like people reacting to the arrival of a villain in an old movie. Now, it isn't all that surprising, I guess. This hearing was filled with a lot of conspiratorial claptrap. Most of it went unchallenged. But at the heart of the hearing was the debate over whether businesses should be able to mandate that their employees get vaccinated. And coming up this morning, we'll talk about the business side of the debate, including whether businesses can afford not to demand vaccination among their workers. A little later on, Afghanistan has been the focus of world attention this past week, of course. But for the massive Lebanese population in Metro Detroit, there is a different disaster begging for attention. Fuel, medicine, and now even bread. Hard to find as the Lebanese economy is evaporating before our eyes. It's all today on Flashpoint. Workplaces, restaurants, and venues all over the country face the decision that most of them most assuredly would rather not have to make, and that's whether to require a COVID vaccine for workers and for customers. This is very foreign territory for most business owners and CEOs, and this week, a legislative committee hearing was held to try to take that decision away from businesses. Let's talk about the way forward with Portia Robeson, the CEO of Focus Hope. Chad Livengood is the senior editor for Crain's Detroit Business. I want to start, though, with Brad Williams, governmental relations expert for the Detroit Regional Chamber, who was a part of that hearing on Thursday. Brad, that, to me, watching, seemed to be a surreal experience for you, to say you weren't there to force or deny vaccine mandates, but you were there to tout the benefits of the vaccine, and you got booed.
Well, that was a first for me, Devin, and good morning. I've been doing this for a long time, and I've never been booed as I was doing my job. But, we went in there, and there was a lot of testimony from, discredited doctors and nurses, long been discredited. And we thought it was important that the legislature hear from actual, business community and know that we're not going to sit here and let them impose this sort of regulation on the business community without a fight. So we went in there to talk about that, and then, had a long conversation about, whether or not vaccines were actually helpful. What we know as the business community is the only way out of this pandemic is by getting vaccinated. And, even though nobody in that room besides me wanted to hear it, I thought it was important to say.
Well, I suppose some would argue that I need to have the other side of that debate that you faced on this program with me, but I am not about to let, you had people arguing that masks cause cancer. I mean, it was a buffet of all of the misinformation that we've seen about the vaccine. And I'll go back to the point that you were not there necessarily to say that there should or shouldn't be a rule either way for businesses, right?
Right. All I was saying is that it's not up to the legislature to decide how businesses keep their customers and their employees healthy.
Yeah.
If the business decides that it is through a mandate, then they should have that right. If they decide that it's personal responsibility, then that's all right too. But it's not the legislature's place to step in and tell the business how to keep their employees and their customers safe.
We've seen this with the masks, with the debate over whether or not you can impose a restriction against restrictions. It's kind of it's an odd place to be. Portia, you're the CEO of Focus Hope. Your business is situated in a city that right now has a very badly lacking vaccine rate. So tell me about how you've gone about making the decision and what you think the calculations are that business leaders should be making.
Well, I'm sure you could see me take a deep breath as you were leading into this question, because it is really the thing that keeps me up at night. We are going to welcome back small children in our early Head Start and Head Start program as soon as the next 3 weeks. And how do we keep them safe unless we either mandate that our employees get vaccinated, which I've held off on doing because I really wanted to see what percentages we had when we got to this point. And how do I keep 4-year-olds with a mask on? There's been some kind of idea about how we can do that, but we know it's going to be a challenge. We cannot social distance with little kids, right? The whole nature of our education process is to embrace those children and to have them engage with one another. And so the idea that people are still fighting using masks if they will not get vaccinated is mind-boggling to me, because we know that that is one of the ways to keep people safe. And I wonder how some of these folks who are adamantly against vaccinations and masks would feel if they were standing in a hospital room with someone's child who unfortunately may be very sick or even dying because they sent their unvaccinated child, or they came into a school system where the children were unvaccinated. Yeah. I can't imagine that this has become the way it has.
Portia, I said on this program about 2 weeks ago that for all of the thought that there's this push from the right against the vaccine, we cannot blame Tucker Carlson for the low vaccine rate in Detroit. What are you hearing about? Do you think is there any progress being made now that we're watching case counts go up again? Now, they haven't happened as much in Michigan and other places, which has forced the issue in some other states. What are you hearing is keeping this rate so low?
I think I think there's some legitimate fears, or there were when the vaccine was first offered to folks, but we've had enough time now for people to speak to their physicians, to speak to people they trust, to do their own research as much as possible. I know that's what we've offered at Focus Hope. We brought in some physicians early on to kind of talk to our population, our employees, to say, ask the questions you need to ask. Yeah. At this point, I just think it's in some ways political for them too. It's almost a badge of pride. I'm not getting the vaccine. I don't know what's in it. Well, you know what? There are a lot of things that you probably indulged in throughout the course of your life that you didn't know what was in it. I said, anybody who's making that argument, I better not ever see them in a fast food drive-thru, because you absolutely do not know what's in somebody's fast food hamburger, and you've been indulging in that for the last 45, 50 years. So there's no reason that you shouldn't get a vaccine. You don't know what's in aspirin when you take it in the morning, right? So, the idea that people are still walking around saying, I don't know what's in it, and you just got tested, just got approved. The reality of it is that science has been working on a vaccination for a very long time. And so I know there's a level of distrust. There's a level of distrust from government. I'm happy to see even more ads and more people coming out to say, listen, particularly Black men and women who are saying, I got the vaccine, and I think it's safe, because I think that is kind of the only way we're going to get particularly minority populations to believe that the vaccine is helpful.
Chad, there's a huge pile of books there behind Portia. I know there's not one of them that says how to lead your company through a pandemic. So as you talk to business leaders, I guess they have, as bad as it might sound, to force a vaccine mandate on some, I think some of them are worried about not doing that, right?
They're worried about what's going to happen with their workforces if they're going to have shortages. And we did a survey just this week on just asking business executives take their temperature basically on this issue right now. And 54% of the business leaders said that they support vaccine mandates, but just 19% of those folks said they're actually mandating vaccines in their workplace.
That's
So
an
there is
interesting
a pretty-
disconnect. Yeah.
Yeah, a pretty big disconnect where yes, go ahead, you first, basically is the mantra here, and so I think you're going to start seeing the tide changing a little bit. Right now, we're seeing this huge debate over schools because the governor, Gretchen Whitmer, and her health director, Elizabeth Hertel, are sitting on the sidelines this time. They're not going to issue a statewide mandate.
Clearly
there's
at odds with the chief medical officer, Dr. Khaldun.
Yeah, I mean, Dr. Khaldun said, "Look, I have advised the governor that if we had a mask mandate, it would lower the rate of transmission. This is a complete, reversal from the Whitmer doctrine that was believe and listen to the scientists first, and we're only left to sort of speculate that there is political science here at work, that the governor is seeing the polls, and that mandates from the state over schools really anger a lot of parents, and right in the middle, and so they're just going to sit this one out. Interestingly enough, Wayne County this week said we're advising schools to do this,
right.
and so has the Department of Health and Human Services. In West Michigan, just today, or just on Friday, the Kent County and Ottawa County health departments issued mandates for all K through 6 schools to be masked. Allegan County's health department has done so as well, as well as Kalamazoo County. So Rock Rib Republican West Michigan is leading on mask mandates. It's just like, you can't make this stuff up at this point, Devin.
You sure can't. Brad, I want to get back to you then on as we circle around on this. When the chamber isn't mandating for or asking for mandates, isn't there a liability worry here that businesses have to face, especially when you're talking about customers, if you have a venue kind of situation? I've only got about 30 seconds left, but isn't liability a big worry here too?
I think everyone has to make the best decision for their own business that keeps their employees and their customers safe. We've obviously seen some venues that are requiring vaccines. We're requiring vaccines for the Mackinac Policy Conference. I think where it's tight, that makes all the sense in the world.
Great conversation. I know you all have a lot on your plate. Thanks so much for sharing it with us. Have a great weekend. Thanks for the time. We come back, we'll talk about the other crisis that's going on in the Middle East, one that you haven't heard as much about. It's in Lebanon. This is Flashpoint on Local 4.